Welcome to Strong Lungs, Strong Life, a smoking cessation class presented by Clearview Cancer Institute. Before we begin, I would like to give you a brief introduction to CCI. Clearview Cancer Institute opened the doors to a new 3-story, 115,000 square foot facility on October 23, 2006. The practice, originally named the Comprehensive Cancer Institute, was previously located in downtown Huntsville and connected by a sky bridge to Huntsville Hospital. CCI has been in business for nearly 10 years. Currently, we have 11 medical hematologist-oncologists, 13 physician extenders that include both nurse practitioners and physician assistants, as well as 6 radiation oncologists. We try to make visits and treatment plans for our patients as easy as possible for them by housing most everything they may need within our facility. We have a radiology department for routine scans, and should a patient present with an emergent situation, having access to a radiology department and the results of scans quickly is invaluable. On the second floor, Huntsville Hospital outpatient is housed. The need to admit to the hospital simply for blood and/or platelets is now eliminated. Here at CCI, we try to offer a variety of programs to meet the needs of our patients and family members. We offer multiple education sessions and conferences that teach about chemotherapy side effects, disease management, risk factors, as well as many others. We offer a special counseling class called Coping with Cancer to help our patients newly diagnosed with cancer to deal with their upcoming journey. Currently, we are developing a survivorship care plan for each patient that will guide them through the treatment phase in the following 5 years post-treatment. But tonight you are here to see another side of what we do, and that's prevention. Usually the big thing everybody thinks of when we talk about cigarettes is lung cancer. So our mission is to help decrease the occurrences of lung cancer here in North Alabama. This program is in conjunction with our lung cancer screening program that we offer on an annual basis. There are some criteria as far as how long you have smoked and how much you have smoked, but the idea is that by using CT scans instead of x-rays, we are better able to detect lung cancers earlier than we ever have before. This is very exciting. Most lung cancers are caught in stage 3 or stage 4. Most of the time, this is too late for a cure. So the goal is to catch it earlier in the stages at stage 1 or stage 2 and have surgery to remove the tumor. The earlier the cancer is found, the better chances for cure. But way before screening, if we could stop smoking early in life or teach our young people to stop smoking or never even start, then we would not even have to worry about it, right? So we are all here to do exactly that, learn new methods so that we can quit and we can stay quit forever. So let's get started. This program is a 9-week program, and the plan is that you may access each class at your own convenience and work at the program at your own pace. We will cover the following objectives during this program. First, understand nicotine dependence. Second, understand the benefits of quitting smoking. Third, learn the underlying cause of your smoking habit. Fourth, learn skills to help cope with urges and withdrawal symptoms. 5, learn the different methods available for assistance. And finally, develop strategies for getting support from your family and friends. Your objectives will be covered through a 9-week course. Week 1, preparing to quit. Week 2, breaking the habit. Week 3, choosing your method. Week 4, smoking, stress, and avoiding relapse. Week 5, what if I slip? Week 6, the difficulty of quitting. Week 7, slow down and breathe, as well as heart to heart. Week 8, the C word. And finally, week 9, the new me. The first thing to consider moving forward is that knowledge is power. Let's consider some of your reasons for smoking. There are many different reasons that people smoke. Some may be a standard reason, and some may be a reason that are unique to the individual and their situation. The number one reason for smoking is stress. A few other reasons are it makes me feel good, pleasure, and/or because it is a habit. It is a habit to light a cigarette when driving in the car, after eating dinner, or it could be a habit to light a cigarette when talking on the telephone. We will discuss those habits a bit later. But did you know that smoking actually causes your heart rate to rise, your blood pressure to go up, And not only that, but it can cause your lungs to look like this. Smoker's lung may have so much particulate material that the lung looks gray-black to the naked eye. Most of the time, you don't need a microscope to tell if someone is or was a heavy smoker. A naked eye examination of a smoker's lung will usually reveal an enlarged gray-black lung with enlarged air spaces. What really is in a cigarette? There are approximately 600 ingredients in cigarettes. When burned, they create more than 7,000 chemicals, and at least 70 of these chemicals are known to cause cancer, and many others are poisonous. Many of these chemicals are also found in consumer products, but these products have warning labels. While the public is warned about the danger of these consumer products, there is no such warning for the toxins in tobacco smoke. Here are a few of the chemicals in tobacco smoke and other places they are found. Acetone, which is found in nail polish remover, acetic acid, an ingredient found in hair dye, ammonia, a common household cleaner, arsenic, which is used in rat poison, benzene is found in rubber cement, butane is used in lighter fluid, cadmium is an active component in battery acid, carbon monoxide is released in car exhaust fumes, formaldehyde is an embalming fluid, hexamine is found in barbecue lighter fluid. Lead is often used in batteries. Naphthalene is an ingredient in mothballs. Methanol is a main component in rocket fuel. Nicotine is often used as an insecticide. And tar is material for paving roads. There's no wonder that cigarettes can be so addictive. Every time you exhale, your family, friends, or colleagues are inhaling a mixture of gases and fine particles that include the previously discussed chemicals and carcinogens. So what exactly is secondhand smoke? It is the smoke from a burning tobacco product such as a cigarette, cigar, or pipe, or smoke that has been exhaled or breathed out by the smoker. Most exposure to secondhand smoke occurs in homes and workplaces. Secondhand smoke exposure also continues to occur in public places such as restaurants, bars, and casinos, as well as multi-unit housing and vehicles. Fortunately for us here in Huntsville, most restaurants are now non-smoking. But how could we protect our loved ones from secondhand smoke? Eliminating smoking in indoor spaces is the only way to fully protect non-smokers from secondhand smoke exposure. Separating smokers from non-smokers within the same airspace, cleaning the air, opening windows, and ventilating buildings does not eliminate secondhand smoke exposure. Since 1964, 2.5 million non-smokers have died from exposure to secondhand smoke. A few of the benefits of smoking cessation will be discussed several times throughout this course to remind you of what your body will gain when you quit. Let's review these for the first time today. Within a mere 20 minutes of quitting, the temperature of your hands and feet increases and your blood pressure will decrease to your normal level. Just 8 hours after quitting, the carbon monoxide level in your blood drops to normal. Within the first 24 hours, your risk of having a heart attack decreases. Lung function refers to how well our lungs are working. Just 2 weeks to 3 months after quitting, it will improve by 30% as well as your overall circulation. 1 to 9 months after quitting, coughing, sinus congestion, fatigue, and shortness of breath all decrease. The cilia, which are tiny hairs in your lungs, regain normal function and increase their ability to clean the lungs and reduce infections. 1 year after quitting, the risk of coronary heart disease is 1/2 that of a smoker's. 5 years after quitting, stroke risk is reduced to that of a non-smoker's. 10 years after quitting, the death rate from lung cancer is 50% lower than that of a smoker's. The benefits of smoking cessation are not just health benefits. You will begin to notice significant improvement in your finances as well. Recent studies show, on average, that a pack of cigarettes will cost $5.80 in the state of Alabama. You can see above how much that equates to on a weekly and yearly basis, depending on the amount you smoke daily. In some states, like New York, a single pack of cigarettes will average you about $14.50. On your handout, write down how much money you can save based upon how much you are smoking now. Think about what you can actually do with this money. Don't do something boring or logical. Do something fun. Buy something you've always wanted. Splurge. This is your big reward. This is where journaling can begin. Keep a small notepad for you for the week. Document each time you smoke and what you were doing at that time. Later in the day, look over your notes. Do you notice a trend throughout the day? Did certain activities precede the cigarette? If so, document that information. That is going to be useful to you later on. This cigarette tracker is available on our website to download to help you record your routine and trends. You may or may not find it useful, but it's available to you as you need. What are your likes and dislikes regarding smoking? What do you associate with smoking that has a huge influence on you? This will make you more determined and armed with the information so you will be able to plan ahead. Don't put yourself in situations you're not ready for. For example, if you associate meeting up with friends and having a drink and a smoke, then wait till you are more confident before you next meet up with them. If meeting up with your friends is something you have difficulty putting off for a few weeks, then ask them to do something different. Go to a movie, bowling, or go for a hike. You will still be spending time with your friends, but you will be in a different environment that will make it easier to resist the urge to smoke. If you have felt that in the past cigarettes have helped you in a time of stress, then think of other ways you can alleviate the stress. Add this information to your journal. Review it frequently to remind you of the reasons you want to stop smoking. Start thinking about some triggers that pertain to you and write them down in your journal. Some examples of common triggers are outlined above. We will dive into these deeper later in the course. The acronym START will be used throughout this program. We will start today with S, and as we move forward, we will come back and review this slide as needed. S. Set a quit date. Finding a time to quit isn't easy. Some smokers like to pick a day that is meaningful to them, but it doesn't have to be special. Any time to quit is a good time, when you are ready. Choosing a quit date increases your chances of success because setting a specific goal increases motivation. If setting a quit date isn't right for you, that's okay. While there is no perfect time in quitting, you may need more preparation and can go over your reasons for quitting to help you feel more confident in setting a quit date at a later time. Do you have a quit date in mind? If you do, place this date in your journal. Before we conclude week 1, let's review some common myths and truths regarding cigarettes. Myths. Cigarettes alleviate stress. Or, cigarettes calm you down. The real fact is that cigarettes are a stimulant that raise your blood pressure and increase your heart rate. Remember, having a cigarette is not going to make your stressful situation any better. The problem will still be there after the cigarette. Now for some truth. When you smoke, you are taking deep breaths in and deep breaths out. If you take the cigarette out of the equation, you are simply using deep breathing techniques. Try using deep breathing exercises to help you through the times of stress. Quite often when people are in stressful situations, they take themselves away from whatever is causing that stress and are able to calm themselves down. So, just to summarize, monitor the amount you smoke using our cigarette tracker. Think about the actual date you would like to quit and write it down. We will continue to work on our acronym START over the next couple weeks. Make a list of friends and family you will tell, and next week we will discuss the benefits of telling someone your quit plan and the next steps to prepare you for your journey. Thank you for joining us for week 1 of Strong Lung, Strong Life. I hope that you will take the time this week to think about and complete the things we discussed today. Work on your journal, identify those triggers, and begin to put together a plan for finishing this journey as a non-smoker. Thank you, and I hope to see you for week 2.